I am a dental student in the third year of my degree. I've been told that I must be fully vaccinated in order to continue my clinical attachments with patients that have already started, and by extension to achieve the learning requirements for me to pass my course. I am not vaccinated, and as a result, I am likely to have my education interrupted and may even be forced to leave the course. The Dental School Council states that part of the basis for this is because non-vaccinated students pose a risk to patients. Yet, as the literature strongly suggests at this point, vaccination status has little impact on one's ability to catch the virus, no impact on viral load, and as a result, no tangible impact on transmission. Vaccinated students should, in this regard, pose no less of a risk to patients than unvaccinated ones. Furthermore, those who are unable to get the vaccine for medical reasons have been informed they will be able to continue their placements. Objectively, there should be few reasons to believe that someone with medical exemption poses a lower level of risk in terms of transmission than anyone else who is unvaccinated. So how are they deemed safe to continue with their placements without vaccination when other students are not? There is an implication here that vaccination is the only way of ensuring patients are safe, when we already know this not to be the case. In the dental hospital I train in, there are many safeguards in place, including PPE requirements and protocols around aerosol generating procedures, to name a few. These have allowed treatment to go ahead in a manner regarded as safe, without the need to consider mandatory vaccinations. Regardless of how you feel about the COVID-19 vaccines, it should therefore be evident that such a mandate does not protect patients or staff, and will only serve to exacerbate the severe staffing shortages, leading to a worse quality of care within our health service, but more so, a worse quality of education for upcoming healthcare professionals like me and my fellow students. This puts us all at more risk, not less.